All right, welcome to The Explainer. Today, we're jumping right into one of the biggest transformations happening in modern medicine, the incredible fusion of AI and healthcare. We're going to go way beyond the hype to see how these algorithms are already changing how patients are treated, and we'll also uncover the huge challenges we absolutely have to navigate along the way.
So, could an algorithm save your life? I mean, this question, it really cuts right to the core of what we're talking about. And this is not science fiction anymore. For more and more patients, the answer is already yes. AI is quietly becoming a critical partner in the exam room, in the operating theater, and in the lab. The stakes? Well, they couldn't be any higher.
And this quote, it just perfectly nails the scale of this whole shift. Coming from Bessemer Venture Partners, it reminds us that AI isn't some niche tech that's way off on the horizon. No, it's the fundamental plumbing of our digital world, and that now includes our health. The revolution isn't coming, it's already here.
So, let's start with the tools themselves. How exactly is AI beefing up the skills of doctors right here, right now? We're going to look at 3 really concrete examples where this new toolkit is already making a life or death difference.
First up, prostate cancer. You know, a traditional biopsy is kind of like trying to find a specific spot in a large block of cheese by just poking it with a dozen needles. So it's really not surprising that these biopsies can miss up to 52% of serious cancers. But now, researchers at Stanford have developed an AI called ProCSNet. What it does is analyze the standard ultrasound images taken during the procedure to guide doctors way more accurately.
So what does this 44% really mean? It's huge. When ProCSNet analyzed the exact same ultrasound images that human doctors looked at, it found 44% more cancerous lesions. See, this isn't about replacing the doctor. It's about giving them superpowered glasses to see what was basically invisible before.
Okay, now this is really cool. It shows how AI simplifies a super complex job in breast cancer diagnosis. Pathologists have to figure out something called a HER2 score, which is critical for deciding treatment. This AI microscope automates all the tedious parts, like finding the exact cancer regions and grading the staining, which frees up the pathologist to focus their incredible expertise on that final crucial verification. It's a perfect example of human-machine teamwork.
And AI's impact isn't just diagnostic, it's operational. It changes how the whole hospital runs. A study at Mount Sinai found that an AI model could predict which ER patients would need to be admitted to the hospital hours before a human doctor would normally make that call. Can you just imagine the impact on hospital overcrowding and patient flow if you have that kind of heads up?
So these incredible tools, they don't just magically appear, right? They're the product of this massive and rapidly evolving ecosystem of technology and business. So let's pull back the curtain a little bit and look at the systems that are making all of this possible. The business side of AI healthcare is just fascinating. Bessemer Venture Partners has identified 2 main flavors of startups here. On one hand, you've got the AI supernovas. These guys just explode with ridiculously fast growth, but that growth can be pretty fragile. And then you have the AI shooting stars. Their growth is more like a traditional successful tech company. A bit slower maybe, but much more durable because it's built on deep, real value. And this innovation is just exploding in every direction. For instance, one review found 23 different digital tools being developed just to detect the earliest signs of Alzheimer's disease. And we're talking about everything from analyzing speech patterns to using augmented reality games, all designed to pick up on those first, incredibly subtle changes in the brain.
But, and this is a huge but, all of this amazing progress hinges on just one thing: data. And in healthcare, that's a massive challenge. Data silos are basically the nightmare for any AI developer. You've got information trapped in different hospital systems in totally different formats, which makes it incredibly hard to gather the huge, high-quality data sets you need to train reliable AI models. It is, without a doubt, the single biggest hurdle we need to get over.
So we've seen the power, we've seen the potential. It's mind-blowing. But with that kind of power comes some really heavy responsibility. We simply cannot talk about AI in medicine without facing the complex ethical questions that pop up when we start to trust algorithms with our health and with our lives.
This is the question. This is the one that has to guide the entire conversation. We can build an AI that's incredibly accurate, that's brilliant, but if it only helps certain people, or even worse, if it actually makes existing inequalities even deeper, have we really made progress at all?
Some fascinating research published in AI and Society breaks these challenges down into levels. At the macro or global level, you have the risk of a growing gap between the countries that have this tech and those that don't. At the meso or organizational level, there's the danger of technological solutionism, this belief that you can just throw tech at deep social problems. And then at the micro level, the individual level, there are real concerns about losing our own autonomy.
And let's be crystal clear. Bias in AI is not some hypothetical, maybe in the future risk. It is happening right now. This quote is from a study that found large language models, the same tech behind things like ChatGPT, can absorb and then replicate the biases from their training data. This can lead to different medical advice based on a patient's race or their income.
Okay, so this brings us to our final and maybe most important section. Faced with all these challenges, what are we actually doing about it? Regulators, researchers, the public, everyone is now trying to figure out how to build a future for AI in medicine that isn't just powerful, but is also trustworthy, fair, and safe.
And we are starting to see some real, concrete action. Take California, for example. They've proposed new rules for what's called automated decision-making technology, or ADMT. Now, this example is about employment. It requires employers to tell people they're using AI and let them opt out, but it gives us a really good blueprint for the kind of rules we could see applied to healthcare. It's a huge step.
Ultimately, this all comes down to trust. A study on sharing genomic data in Australia found that whether or not people were willing to share their most sensitive health data depended entirely on the purpose. And what this chart shows so clearly is that people are overwhelmingly supportive of sharing their data for publicly funded research, but way, way less comfortable with it being used for commercial reasons. It just highlights that building public trust is absolutely non-negotiable.
And so, this is where we land. The technology is getting smarter at an exponential rate. AI can read every medical textbook, analyze millions of scans, and see patterns a human could never spot. It is learning the science of medicine. But the art of medicine, empathy, ethics, judgment, that's a whole different story. As we bring these powerful new tools into our lives, the defining challenge will be making sure they're guided not just by data, but by our deepest human values.